Hello and welcome to week 5. We'll be talking about the CMS1500 and the UB04 claims. As you can see, I have a copy of the CMS1500 paper claims. Providers are encouraged to submit claims electronically using this form. This is a claim form that only physicians are supposed to use. It's not used in the hospital, and it should be submitted electronically. And if they follow the guidelines on submitting electronically, it will ensure timely and accurate processing of the claim through the OCR, which is the optical character recognition system. If you were working in a physician's office and you were actually looking at a manual claim, it would be a red printed CMS 1500 claim version, which photocopies are not required or not acceptable through the OCR system. You have to have the actual red claim. You would print these claims if you did them manually using all caps with dark black ink, and then you would use dark blue or light black print. Too often if you use dark blue or light black print, they're often too light to be read by the OCR equipment if you're submitting electronically. But if you do need to manually correct some information, you would just write your corrections clearly with a dark ink and no red ink, and cross out the unneeded or incorrect information. Don't use any red pens, markers, or blue or green highlighters. You want to align your claim form so that all your information is within the appropriate box. If you poorly align the data, it could be read incorrectly by the optical reader, which is optical character recognition reader. And then if you handwrite the claims and try to send it through electronically through OCR, it's not going to be accepted. So one thing I do want to do is kind of go over some of the fields here on the claim form, whereas in item number 1, that's where your patient's benefit plan number is supposed to be entered. Just submit the prefix and patient's benefit plan number that is in effect at the time the services are provided. Do not put a space between the prefix and the patient's benefit plan number there. And I'm just giving you some tips as I go along and looking at this claim form. In item 3, which is item 3, is the patient's date of birth. Patient's birth date and sex. You want to make sure that you enter the birth date using, month, day, year, format, and you'll enter an X in the appropriate box designating the sex of the patient, which is up here, male or female. And in item 4, where there's the insured's name, you're going to enter that last name, first name, middle initial with spaces between. For example, you would put something like Jane A, the middle initial is A, period, and then Doe. And it should be shown as Doe, which is last name first, and then Jane, and then the middle initial. Don't list as same when the patient is the same as the insured. This is also true in item number 5 for the patient's address and item number 7 for the insured address. You have to list all the names. You cannot say same in those particular boxes. In item 6, which is the patient's relationship to the insured, you're going to put an X in the appropriate box to indicate the patient's relationship. Okay, so in item 17B, and that's going down here to 17B, this is where your NPI number information is going to be entered. This is the number of the referring, ordering, or supervising provider. And then let's look at item 20. Item 20 is right over here. So I'm sorry, item 24D. I just want to point this out. This is where procedure services or supplies. In item 24D, this is where your procedures and services and supplies will be entered. You'll enter the CPT, the HCPCS codes, and modifiers from an appropriate code set in effect on the data service. So this takes you down to the 24E, which is diagnosis pointer, right here. And then F is the charge, going to be the actual charge for the listed service that you provide. And then 24G is the days or the units. This field is commonly used for multiple visits, like units of supplies, anesthesia units, or the number of minutes, or oxygen volume. If only one service is performed, then you would only put a number 1 there. 24J is the NPI of the referring provider or facility. And then item number 28 is the total charges for the services. And then item 32 is the NPI of the facility location. And then item 33 is the billing provider NPI. So if more than 6 detailed lines of information are required on a CMS 1500, you have to submit another CMS 1500 claim form with that additional data. But each claim will be considered as a separate claim and must be totaled separately. Now let's talk about the CMS 1450, which is the UB04. The CMS 1450 is an all hospital or institutional claim, and you would bill all hospital and institutional services on the CMS 1500. I'm sorry, the CMS 1450, which is still considered the UB04. So like the CMS 1500 form, an inpatient hospital coder would fill out the UB04 form with the procedures and charges from the patient's visit. Then the form is sent to the patient's medical insurance. Once the insurance receives the form, they review the charges, determine the patient's benefits, and pay out according to the negotiated rates. Unlike the CMS 1500 form, the UBO form includes a much more complicated set of boxes. And as you can see here, it's a lot more complicated. These specify the types of services provided during the patient's hospital stay, and they need to be filled out accurately to make sure that the claim is paid correctly the first time it gets sent. So when you're filling out that UB04 form, it does include some of the same basic boxes as CMS 1500 form, such as your patient demographics, which is your patient name, date of birth, all of that good stuff. And then also your provider's identification information is entered on this form. Procedures and charges are entered on the form, and also insurance plan identification information is on this form. So as you look at the top of the form, it includes an area for the provider information, including their federal tax ID number. There's also a space for the patient's medical record number, which is far right, which is assigned by the patient or assigned to the patient by the provider's office. Underneath this section, there's a small section on the patient side that has some identifying information where it has occurrence dates and condition codes. That information would go there, and there are necessary parts of hospital. Well, these condition codes are necessary for hospital billing because a lot of people who are admitted and treated in the hospital have complicated life-threatening conditions. So the more information provided to the patient's insurance, the better. And this includes facts like when the first occurrence started, whether it was a recurring or onset, or whether or not it was related to an accident. So these fields here will have numbers there that indicates, occurrences are accident related. Underneath the patient condition, occurrence, date, span boxes is a large section where you can describe what procedures were performed on the patient, and a large section in which you would include the HCPCS Level 2 codes. Now, one thing is because hospitals provide many different types of services for patients, including supplies, transportation, and machine, they bill for many more HCPCS codes than individual providers. So the UB04 has a large section where you can include all necessary HCPCS codes, including a section in which you can indicate how many pages of codes are included in the claim. And then underneath that, there's also a large section where you can include up to 18 diagnosis codes. And this is necessary because a patient may have many different presenting problems in the inpatient setting, especially like during surgery or following a serious illness or emergency. And finally, under the diagnosis section is a section for additional procedures and remarks. And to the right of this, there's another section where you can refer to individual providers, including attending and operating doctors. So I know that both of these forms look very different. However, they do have some similarities in, entering the patient demographics and provider information. But what makes these two forms so different is because while hospitals don't generally charge for patient procedures, doctors do. And when a doctor performs a procedure at a hospital, they'll bill their services individually to the patient's insurance using the CMS1500 form. And the hospital in which the patient is seen, however, will also need to be reimbursed by the patient's insurance for the services they provided during the course of the patient's care. And so this is why the UB04 form has such a large space for HCPCS codes, and the institutional provider is specifically designed to allow more room for those HCPCS rather than CPT codes. And this is because they're the majority of the services provided at the office visit. So just keep in mind that hospital coding is very different from regular provider coding. Hospital is done on UB04, provider coding is done on the CMS 1500. But just keep in mind that your ICD-9 diagnosis codes, you would use the same types of diagnosis codes on the UB04 as you would a CMS 1500. But you could use a different set of procedure codes on these particular forms. So just understanding the basics of these forms will keep you abreast of what's required, and it also is an essential part of being a successful hospital medical biller or coder, or a physician's biller or coder. Thank you.